Hello, everyone. It's my great pleasure to welcome you to today's webinar on how to make digital payer engagement work. It's a bit of a broad topic, so we'll try to make it a little more tangible within the next 30 minutes. With me today, I have Louis. Hi, Louis.
Hello, Federica.
Louis is one of our most experienced client directors here at Agnitio, and he's responsible for a number of our large global clients, including their market access teams, and it will be Louis who will take you through today's session. So my name is Federica, and I'm responsible for product marketing here at Agnitio. As a natural part of my role, I have been in dialogue with many of you on how we, as a digital engagement provider, can help you as an industry with the growing influence of institutional buyers. Before I hand over to you, Louis, I will just take a quick look at your responses from signing up to this webinar. So the absolute majority of you are looking at delivering better value stories. So that will be today's overarching umbrella. Approximately 1/3 of you are looking at driving digital capabilities. In a webinar that we had with IFA Pharma not long ago on digital payer engagement as well, 45% of the almost 300 attendees said that they're beginning to venture into the space of digital, with 9% stating to be on top of digital payer engagement. So this is obviously the time to start moving in market access as well. In today's session, we both have, I can see GSK, Boehringer, Coloplast, Novo Nordisk, and UCB joining. So a broad life science representation, knowing that you have quite a different definition of market access and your payer segment. We will try and get us all on the same page before diving into how to drive digital capabilities in payer communication. Right, Louis?
Right.
So one thing we do hear, though, from most companies is that when entering digital payer engagement, you want to, first of all, deliver better value stories, as you've already stated here in the stats. This is both related to the company, but also to the product USPs. Second, you want to deliver compelling health economic arguments. This can be done with interactive calculators, both on value or budget. And then finally, you want to align commercial activities to create harmonized customer experiences across the touch points that sales, marketing, and market access would have. So I think that would be my segue into your presentation, Louis. I would just like to remind everyone that this webinar is being recorded, so you will receive the recording afterwards, and also we will have a Q&A at the end of the webinar. So feel free to write questions throughout the session in the right sidebar, and we'll take them at the end. Thank you so much for joining once again.
Thank you, Federica, for the nice introduction, and as well for sharing here on the screen some of the status of where the industry is moving into payer engagement becoming digital. 45%, I see you mentioned it's starting to venture. Another quarter is not quite sure, and then someone else falls in between. So hopefully today I'll be able to inspire some of you to get those initial projects going, getting your learnings and getting hands-on on what digital can do for your engagement with your decision makers. So let's dive in. Today we'll begin first and foremost understanding why is it that we're talking so much about digital now when it comes to the payer sphere. We'll see what are some of the drivers behind us turning to digital engagement to support in our communication. We'll see what the payer landscape looks like. I know that Federica mentioned we have a rather diverse group of companies joining from both pharma and medical devices, so we'll try to find some common ground. Last but not least, of course, we want to see how this looks like. So I will share with you a few cases and a few examples of how we are getting started with payer communication. Please, I welcome you throughout the session. You can always write your questions on the text box, and we will take them as we go or right at the end. So please, anything that calls your attention, feel free to challenge us, feel free to ask, and I'm happy to make some time at the end. So why applying digital to payer engagement? And the first answer that pops to mind is that the influence of payers is changing. The Boston Consulting Group reports that the cost of healthcare is rising close to double the rate of GDP, which means there's more patients to take care of, and there is increasingly less budget in proportion. So they're becoming much more restricted in their approvals. What is it that they're willing to pay for, as well as becoming more aggressive on how they manage their cost. We see now the trend of centralized standards becoming more and more common, not just within a country, but cross-country as well, or across therapeutical expert groups. So we will see how this has an influence in how you actually talk to the payers. That takes us to the conversation around value. If cost is being managed so closely and questioned, we want to make sure that we're able to communicate our benefits and our value directly to those that are going to make the decision. Now, we generally accept as value that balance in between patient outcomes and the total cost of care. And I will make an emphasis on the total. It's not just about the price per unit, but what are the other costs related when we're selling a specific therapy or a specific product or service? Are there some savings involved when using our product in comparison to the existing therapy that can contribute positively to the value equation? Of course, taking the patient focus gives us a lot more levers on where to pull to show how this can be beneficial in terms of qualitative or quantitative metrics. And last but not least, I will take this moment to remind us that payers are also people. And like the rest of us, they are increasing the use of digital in their daily lives. And more so, they're doing it at work. We know that year after year, they're saturated by requests, by new indications, and they're receiving these large dossiers with all of the information they need to know. And I'm sure that they enjoy scrutinizing them as much as you enjoy writing them. So there is an element here, a room that we have on how to improve their processing of information and helping them make their decisions better about what would be the best choice for their portfolio for their patients. So payers certainly are changing, and we've been on that boat as well as patients. For payers, we took a closer look at how they use digital in their work, and on average, they report to be spending 3 hours using digital resources. Now, some of you might argue, well, that only makes sense. A lot of the documentation that we shared with them is in digital. However, half of them are telling us that when content is interactive, not just a large PDF document, when it actually helps them make connections or get to the information they're trying to get easier, they do rank it as more valuable. In terms of common goals, here we're mentioning just a couple of them where they're willing and looking forward to collaborate with the industry to reduce readmissions and to improve adherence. You may notice that these are not directly price per unit topics. These are related to the patient and related to the total cost of care. So we certainly have an opportunity here to tailor our communication, tailor our engagement, and to focus on topics that do create value for us as a company, but as well for the payer as a decision maker and an increasingly key player in the industry. Once again, I would like to make sure that we're all on the same page. We're looking here at the attendees. I can see that there's some of you from the States, some of you from across Europe and other geographies. So let's, for the sake of the rest of the discussion, create some general buckets to see and categorize our payers. Starting with the larger group of payers, we can, as we discussed earlier, see the centralized purchasing organizations that are crossing borders and as well playing a very important role within the product life cycles and how product is being perceived. Of course, we have the national and regional, according to your country, entities such as the NHS that look closely for their own population, and they may have some sub-regions that have some decision on either the volume that is being prescribed or the solutions that are being prescribed. For those of you in the US, private insurance companies, Medicare, Medicaid, those will also have a strong bargaining power, certainly a lot of say-so as to what gets included and recommended in certain parts of the US. When talking of local and key accounts, I think this is pertaining a bit more to medical device companies, maybe more so those that have some medical equipment or some product that is very much focused on a local entity, such as a public hospital or a private hospital. And your market access teams will have a function closer to that of a key account manager that are dealing with both economic and clinical claims of the products that you provide. So for the sake of local payers, we'll mention from now onward as key accounts. And very importantly, we also have the influencers. They may not be a payer themselves, but they certainly have a lot of say-so as to what goes into a specific patient population or a specific geography. And as influencers, here we're listing those that advocate on behalf of patients and the medical community. And they like I mentioned, they greatly support or pressure payers for continuing with an existing therapy, or they advocate for innovation. At this point, you might be wondering, well, then how does digital play a part in this? How does digital engagement look like when I have such a diverse group? And the opportunity here of digital falls in facilitating how we deliver the key messages that each of these payers is interested in. Not all of it has to be digital, not every engagement has to be digital, but it will certainly play a part in moving them from uncertainty of what a product can do for them to being an advocate or understanding how we are different to the competition. And now I will step aside from these general buckets and have perhaps a closer look to see how we actually engage with the market and how we as a company can use digital to support our claims. And I will do so by looking at a customer journey, perhaps looking at it as a company rather than as an individual. Here I will exemplify with the launch of a product, perhaps not a product that is a blockbuster, but a traditional product that is new within its therapy area and that has a marginal improvement over the existing products. And we know that in order to introduce a new product, market access has already been dealing and being in conversation with payers 3-4 years in advance, taking them from the clinical trials and pinpointing some of those highlights and making sure that the product is approved, is priced accordingly, and gets into a specific geography. Following this approval, sales and key account managers will meet with HCPs, hospitals, and other members of the clinical community, making sure that the product is fully understood, preferred, and ultimately prescribed. Throughout the cycle, marketing will be communicating a lot of those key brand messages as well as supporting sales and market access in their ongoing communication. Medical experts are, of course, a fundamental part of the life cycle of the product and will take care of the medical buying more than the commercial one. But of course, all of these elements coming together do play into the next cycle. So when entering a next tender, especially if our product somehow lands on a centralized purchasing dynamic, the question that I'll be asking you is, would gathering the insights that we have gathered across all of these touch points from all of our teams, would that help you in perhaps shaping how you communicate with the payers and with the different stakeholders that influence that tender? Would you use some of that information that you have gathered about preferences? Would you use some of that information gathered around what the conversation has been about in regards to your product and perhaps the patient experience? This is how we see the overall digital engagement opportunity. We see it within each engagement with each stakeholder, but also across the entire company. And at this point, you might be wondering, then what do we do? What do we do as Agnitio, and what is our role? As you can see in this scenario, you are the experts and storytellers of your solutions. It might be triggered by a different department, some colleague of yours, but ultimately you are the ones communicating to the market why your product is better and how it can help the patient population. We as Agnitio provide a technology that allows you to deliver that message in a digital way and of course gathering some of those insights. And we do so with our platform, the Rainmaker. And here I'll just make a pause for a 1-minute commercial pitch, because when we use our technology, it's not just enabling of having digital content and having digital engagements, but also learning from those engagements and gathering data. And I'll show you how we do that. Our platform is divided into 3 main components. The first one is the content and the users, meaning all of those messages, all of those tools, all of those stories that you have sitting somewhere in a digital asset. We gather them in one place and we make sure that they're available to be used either, as you saw in the earlier example, for the market access team, for the sales team, or for the medical team, whomever it makes sense. But those stories need to be told somewhere, and that's where the channels kick in. Our platform allows you to show the content in the multiple formats of an engagement. When you're face-to-face showing something on an iPad or on a screen, when you're sitting remotely showing content on a PC or on another device that your audience prefers, and of course sharing this dynamic material and these digital formats with the audience for them to see on their own time, which is of course increasing in demand as they start looking at digital content outside of the office hours, not just when they're engaging with you or with your teams during a normal engagement. As mentioned earlier, one of our key focus is on data, and we'll touch upon that later on after we see some examples. So here we dive now closer, and I would love to show you some examples of what our customers are doing and how you can carry along the value story. And purposefully, we didn't forget to put an image here, but here we're simplifying how much it can vary, the perception of value. The question of what is value and what you would see here as a cool image, it depends entirely on you as an individual. Some of you might envision your children playing at the beach. Some others might envision some extreme sport or a dramatic background of a mountain. And that simple trail of thought also tells us something about what happens when we communicate with the payers. Each of them will have their own value perception. They will have their own interests. They will have their own levers for what they consider value. And when we present our story, they will take a different approach and understanding of what is it that we are presenting. Now, this is something that we have done consistently across the sales rep to doctor communication, and then moving out to different stakeholders. And now when we're dealing with payers, we ask ourselves a little bit harder, what is it that a payer really needs to know? And how can we facilitate that information getting through them so that they can themselves make the distinction of why are we more valuable than a competing product, or are we more valuable to solve a specific problem? The first example that I will show you is something that you are very familiar with, which is a value calculator or a health economic calculator. You might recognize it more when you look at it in a spreadsheet, and you might recognize some of these elements here. What changes when we use digital is that it is a dynamic presentation, meaning when we change one element somewhere, everything gets updated in the eyes of the beholder, helping them make a connection between what is interconnecting when making a decision and how one change of one variable can have a positive or negative impact in something else, whether it is the total cost of care or a benefit for the patient. Where it becomes powerful is when we start combining not just the economic claims, but also the clinical claims or some of those patient stories, because these are all elements that are important for a payer to make a decision. And out of this exact same piece of content, they can jump and see a bit more on what does this mean for the population. And when we're talking of an engagement, we've moved away from talking about a price per unit, and we start talking about the patient and what this would imply for a specific population. When we're talking to national health insurers, this is where we start calculating how big is the problem for you, not just in terms of cost, but in terms of related consequences and externalities to a specific product that we're pitching. We know that this is already sitting somewhere in the documentation, but making it visual and available for the audience makes it stick to their consideration framework when they're deciding, is this going to be part of the cycle or will it be part of the next cycle? So making sure that we're articulating in a visual, in an easy way for them to make their decision increases the chances that we will actually be considered and reimbursed and recommended in this current cycle. As I go through some of these examples and slides now, you can see that it's not standard text fields that we're showing, but also some of those dynamic things that gather input from the audience. As I click and as I move some of these levers, I'm able to capture the individual response to my specific pitch. So as a market access person or somebody in charge of dealing with a payer, I'm automatically capturing some of that data and automatically funneling it to get a better understanding of the account, of that specific payer or that specific influencer. And we'll touch on that in just a minute. Another example from one of our customers is moving as well a bit away from a product by product conversation and thinking a bit more long term. This perhaps resonates a bit more when we're talking with a national audience that has a longer perspective than the usual 1-year cycle. And here we can say we're not just discussing the product that I'm bringing in today, but I can also show the investment that we're making for future new indications, as well as other related therapies that can support to do business with us as a partner, not just on a specific tender. So now let's see what we learned from these examples. So recapping, right now we are looking at some of those learnings and insights that we obtained by using some rather simple but yet powerful digital tools during an engagement with a payer. Like I mentioned earlier, this was not used in 100% of the conversations, but it was used at some point when a payer was trying to come to a decision or to clarify a point around our product or service. So just measuring on those those engagements, we get a sense of what is the interest level of that particular payer. Are they looking at our content? Are they looking at a specific part of our pitch? How active are they? Are there other stakeholders inside that payer structure that are also engaging with us in some digital form? Quantifying that gives us a sense or puts our finger on the pulse of how relevant are we to them, at least in terms of conversation level. Naturally, that leads us to key message identification. Being a digital platform and being a digital medium, we're able to track specifically what are the topics that they're interested in, and perhaps looking closer, some of that data that they're putting into our calculators. How many patients are they estimating for a specific population, as well as what are their concerns in terms of side effects, in terms of benefits, or in terms of cost. We'll be able to quantify and measure on that. Buying center mapping. This comes when we step back from one engagement and we look at all engagements, and when we start getting a bit creative with our filtering. In this case, here we have on screen, looking a bit closer, some accounts that we have added, Atos and Charit and Mercy Hospital and so forth. Of course, this will look differently for you. But when I click on each one of those accounts, I can see with how many people am I actually engaging, and it helps me identify, well, who is influencing the decision, who is looking at certain parts of my digital communication, and how do they fit into my buying center? Who will have a say-so, or who will influence whether they consider that I deliver a good clinical or economical claim? From that calculator that we saw earlier, if we look at all of the calculations that we've done during the engagement across a certain period, we can also start realizing what is the size and potential of the account. How many patients are they estimating? How many doses? How many capital equipments? Simply tracking what we already use in our conversation and organizing that information helps us as a company to be able to plan a little bit further where to focus our efforts, as well as identifying what are the gaps that we have when engaging with stakeholders. And circling back to how we interact with sales, marketing, and medical, data helps us do that seamless collaboration. And by seamless, I mean that we don't need to sit in hours and hours of meetings to make sure that we're sharing our insights just from doing our engagements alone. Those digital engagements, we're able to put the data together automatically and make sure that we're all leveraging each other's work. Of course, at the beginning, when we're launching a new product, it is almost entirely between the market access team and payers and medical department to drive the communication. But once the commercial team kicks in and marketing kicks in, for the following cycles, we will be able to collaborate further. And we believe that digital is an optimal and easier way to do so. With that, I will wrap up here. Having gone through these 3 examples about value stories, about how to combine health economic arguments with some of the clinical arguments, as well as harmonizing and aligning with other sources of communication that we have in the organization. At this point, you might be asking, how do we get started? That this seems to be a large transformation project or a large digital exercise. But in reality, what we're seeing with our customers is that it's starting where and when it makes sense. Meaning, the initial exercise is to have a look at our payer landscape. What are those key stakeholders that we need to engage with? And starting with a quick win, a small project that can validate some of these assumptions that can help us learn, giving ourselves as a company, with our current portfolio and our position in the market, how can we make this conversation better? How can we use digital to support their decision, even if I'm not there? Those small projects, they look very differently across companies. They will look very differently across your specific therapeutic area or type of product. But we're happy to support in that initial conversation. We're happy to sit with you and have that exploratory discussion and figure out how and when you can get started. So with that, I hand over back to you, Federica. I know that there's been some questions coming in.
Absolutely. Thank you so much, Luis. And yeah, I think that you're spot on here in the end. I mean, this also enables you to do this whether you are fully digital in your sales and marketing or not, because you can just start small with pilot, a couple of people, test it out in a market, see how it progresses. And yeah, we stated in the beginning where you had the stats about payers' need for digital. We've seen that also with even NHS and UK, these public or governmental buyers also pulling for digital. It's not just the ones that are more institutional or gathered in accounts. So let's look at your questions. Of course, feel free to keep writing them here at the end. I'm just gonna start here. We have one that asks, so we are a small pharma business. Do you have solutions that fit our needs too? And I mean, this kind of taps into what we just talked about. I don't know if you want to elaborate on that.
I think, so for a small company, I think here's where it's more important than ever. It means you have probably just one product. I don't think it says so over there. But if you have a small portfolio, you have a solution that is very differentiated, and you need to make sure that that is accepted by the payer community as well for the clinical community. So it is a live or die kind of situation for a new product to get into the market. Obviously, being a small company, you've already proven that, and you've gotten started. So getting started here will be from your point of contact right now within the payer sphere. Those that have approved your product and that have gotten you your initial entry to the market, we would map out how many engagements are you having with them. On average, we've heard that is when you initiate a conversation with a payer to when you actually finalize the cycle, about 100 or 200 engagements. Those would be phone calls, messages, send me that file, send me that email. So by analyzing how many engagements do you have, we would assess what can we cut down and what can we do better, and what type of communication or engagement will reduce the number of engagements that you're having, the number of visits or the number of touch points. The more we reduce that, it decreases your time to market or your time to get an answer on whether or not you will be considered into the next cycle. So that simple exercise of simply quantifying and looking at where there are potential for efficiency, it's a good way to get started, and any of the tools that we presented today could support in such an endeavor.
Yeah, agree. I think this one is maybe for the opposite side of the business, the ones that are a bit bigger. But who do you recommend own this type of project? I guess that could be, especially if you have probably sales and marketing involved as well, if you have digital centers within your company, multi-channel, maybe even.
So let me just looking once again at this list. So we have different size companies and of course different support teams inside each company. So what we know full well that the sales and marketing have been working digital for quite a long time now. So there's probably an existing practice of using digital. With payers, maybe it's a bit separate right now. It could be connected, as we saw, with the data, but ultimately, who decides how they engage with their customers, or how they engage with the payers, or how they engage with the market, will be market access themselves. So market access will own which tool and how it's used and for which audience type. How it's executed, it will depend on the organization. So in here, like I said, we just invite to have that conversation with us, and we can figure out what would be the best way to drive it in the organization. But ultimately, who decides to do digital or not, and how this looks like for the payers will be market access.
Absolutely. We're coming to an end, guys. We're going to wrap up, but I just have this final question. We already deliver a lot of tender documentation, dossiers, and clinical studies. So how is this any different?
Okay, yeah, that's a good question. So, and I do hear this a lot. We're saying we've been doing digital for a long time with payers because tender management is digital. We submit a digital format. Clinical studies, they're already in digital format. And the difference to what we discussed today is the engagement. This is not a substitute for the documentation that you need to get a drug approved or to get a drug reimbursed or to provide the right guidance on how to use a specific therapy. What we're discussing is payers need to make a decision about what is going to be approved, what is going to be used, what is the best course of action to maximize the patient outcomes. And in their decision making, they need to look at multiple options. And we're saying you are already supporting that, either with visits or with calls or with some form of an actual engagement that sits outside this documentation. Those engagements are what can create the difference of whether they look at the entire dossier and clinical study that you submitted, or whether they ignore it and postpone it for later. So it's about the engagement, not just about the documentation. And what we're saying is use digital to maximize how you engage.
On that note, that was perfect. Thank you so much, Luis, and thank you to everyone for joining.